Dear students, today we will learn about the overview of bones. The locomotor system consists of bones, bone articulations, and skeletal muscles. The bones of the entire body are connected by bone connections to form the skeleton. The locomotor system accounts for approximately 60% of the total body weight. It constitutes the basic outline of the human body. It has the functions of supporting the body, protecting internal organs, and facilitating movement. In movement, bones act as levers. Bone joints serve as the hubs of movement, while skeletal muscles are the power organs. An adult has 206 bones, which can be divided into 3 parts: cranial bones, trunk bones, and limb bones. The first 2 are also called axial bones. Bones can be classified into 4 types based on their morphology. Long bones. They are long and tubular in shape and distributed in the limbs, such as the pubis and metacarpal bones. A long bone is divided into a body and 2 ends. The body is also called the diaphysis, with an internal cavity inside, which is called the medullary cavity and holds bone marrow. There are 1 or 2 holes on the surface for blood vessels to enter and exit, which are called nutrient foramina. The enlarged parts at both ends are called epiphyses, with a smooth articular surface, which forms a joint with the adjacent articular surface. 2. Short bones. They are cube-shaped and mostly distributed in groups in areas that are firmly connected and relatively flexible, such as carpal bones and tarsal bones. 3. Flat bones. They are plate-shaped and mainly form the walls of the cranial cavity, thoracic cavity, and pelvic cavity, playing a protective role, such as cranial vault bones and ribs. 4. Irregular bones. Their shapes are irregular, such as vertebral bones. Some irregular bones have cavities, which are called pneumatic bones, such as the maxilla. Like the maxillary bone, bone substance is composed of bone tissue and is divided into compact bone and cancellous bone. Compact bone has a dense texture, strong pressure resistance, and is distributed on the surface of bones. Cancellous bone is spongy in shape, formed by the arrangement of interwoven trabecular bones and distributed inside bones. The trabecular bones are arranged according to the pressure and tension directions that the bones bear, so bones can bear relatively large weights. The surface layer of cranial vault bones is compact bone, called the outer plate and the inner plate respectively. The outer plate is thick and tough and full of elasticity. The inner plate is thin and brittle, so skull fractures are more common in the inner plate. The cancellous bone between the outer and inner plates is called diplo, with diploic veins passing through it. Except for the part on the articular surface, the surface of fresh bones is covered with periosteum. Periosteum is composed of fibrous connective tissue and contains abundant blood vessels and nerves, playing an important role in the nutrition, regeneration, and sensation of bones. Periosteum can be divided into inner and outer layers. The outer layer is dense, with many collagen fiber bundles penetrating into the bone substance, fixing it to the bone surface. The inner layer is loose, with osteoblasts and osteoclasts, which have the functions of producing new bone substance, destroying the original bone substance, and remodeling bones. In childhood, osteocyte function is active, promoting bone growth. In adulthood, it is in a relatively static state, but when bones are injured, such as in fractures, the periosteum restarts its osteogenic function, promoting the repair and healing of fractures. If the periosteum is stripped too much or damaged severely, fracture healing will be difficult. Bone marrow fills the medullary cavity and the spaces of cancellous bone. The bone marrow of fetuses and infants has hematopoietic function, containing red blood cells at different developmental stages and some white blood cells, and is red in color, called red bone marrow. After the age of 5, the red bone marrow in the diaphysis of long bones is gradually replaced by adipose tissue, becoming yellow in color, called yellow bone marrow, and losing hematopoietic function. However, in cases of chronic excessive blood loss or severe anemia, yellow bone marrow can be converted into red bone marrow, restoring hematopoietic function. In vertebral bones, iliac bones, ribs, sternum, humerus, femur, and other epiphyses of long bones, red bone marrow exists throughout life. Therefore, clinically, sites such as the anterior superior iliac spine or posterior superior iliac spine are often selected. for bone marrow aspiration, to examine the bone marrow smear. Through today's study, we have learned about the morphological classification of bones and the physical and chemical properties of bones. In the next class, we will start learning about trunk bones.